Prostate cancer is the most common solid tumor in men in the United States. Approximately 230,000 men are diagnosed every year with prostate cancer. About 30,000 men a year die from prostate cancer, which is significantly decreased, almost 50% from what it was 20 years ago when we started looking and screening for prostate cancer. A person should be screened for prostate cancer after a discussion with his physician. An informed consent and an understanding of what it means and what the results will mean is very important to understand what you're going to do with the results. I recommend patients with strong family histories, those of African American descent, and people that are otherwise at high risk that have more than a 10-year life expectancy be screened once at age 40 and then at least yearly after age 50. Many men with low PSAs and low risk for prostate cancer can be screened less often after 50 years old, but should still be followed. Oftentimes I'm asked by a patient's wife, should my husband be screened for prostate cancer? And that goes back to the answers I gave before. Do they have risks? Do they have longer than 10 years to live? What your feelings are. What would you do if you found out you had prostate cancer? My answer is usually yes. More information is good. One of the things you need to watch out for is you may have to stand up for yourself and ask to be screened. Because of the controversies of screening for cancer, some doctors may not offer it. Think about your PCP, your primary care physician, and all the things they need to do. It may be low on their list. So if you're worried about it, if you want to get checked, don't be shy. Ask him to check. Check your PSA, get your digital rectal exam. Both are important. In the last few years, there has been some controversy as to whether we should screen for prostate cancer. We get conflicting evidence. We get conflicting recommendations from different organizations. And it's difficult, even as a physician, but more so as a patient, to understand, should we be screening for prostate cancer? The U.S. Preventive Service Task Force is a government-appointed organization that has recently recommended that we not check for prostate cancer. One of the reasons that they used were two studies that were performed in the U.S. These studies were 5 to 6 year studies, relatively short term, to look at, did people survive because they were screened for prostate cancer? And their conclusion was no. We also know from some longer studies that were done in Europe that if you follow those same patients out for 12 to 15 years, that you do see a survival advantage. There is somewhere in the middle that we need to come to rest. We shouldn't be screening everyone. The 80-year-old man on oxygen who has just had his heart operated on shouldn't be screened for prostate cancer. But the 50-year-old man whose father died of prostate cancer, he should be screened. He is at high risk of dying of prostate cancer. We have to find a middle ground, somewhere where we can screen those who are going to benefit from screening and treatment of prostate cancer and not screen and potentially overtreat those who are not in need of treatment.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.